Hello, everyone. This is Vidal from the University of Oklahoma Stevenson Cancer Center. Thank you so much for taking the time to listen to our presentation today. We'll be talking about the gap between primary care education and radiation oncology. I have no financial disclosures. The only disclosure I have is that I'm a board-certified internist, currently going through radiation oncology training in Oklahoma. Last year, I was a chief resident at the University of Oklahoma and junior faculty within the Department of Medicine, where I supervised and taught over 70 residents. And so this is a topic that's very near and dear to my heart, medical education, and really bringing these two fields that I care about very much together. So the background of our talk, as we know, the concepts, the content for medical students to learn continue to increase. And there's very limited exposure to radiation oncology during the medical school years. During the clinical years, usually third and fourth year, students are able to elect to rotate through a radiation oncology clinic to get more exposure. But even then, not all students can rotate due to limited resources. And so then once these students become doctors, they further specialize into their fields and don't really get a whole lot of exposure to radiation oncology. And so what we're trying to see here is what are the gaps in knowledge about radiation oncology for primary care practitioners. And so we hope that through this project, we will raise awareness about our discipline and the role that we play in cancer care. Also, through this intervention, we hope that patients who have true medical emergencies requiring radiation oncology care will receive expedited care. And then that also oncology patients will receive prompt medical care. Most of our colleagues don't realize the amount of training that we go through as radiation oncologists, that we are the only oncology specialty that receives 4 years of training within radiation oncology, and that we actually have to go through a whole process of knowing how to diagnose, to work up and stage. And so having that knowledge out there, I believe, will only benefit oncology patients. And then lastly, also helping our colleagues understand the workflow of a radiation oncology clinic and department. And so our study will focus on residents who are pursuing primary care training here in the state of Oklahoma. And for the purpose of these studies, we are defining primary care as internal medicine and family medicine residencies. Pediatrics would also be a primary care specialty, but for now, for this phase, we're focusing on these two. And so these residents will be given an initial survey to assess the baseline knowledge that they have. It'll be interesting to see how interns fare against PGY3s, just to get an idea of how much they got out of medical school. We'll then have educational modules focusing on radiation oncology concepts, and then we'll do a post-intervention survey to assess how much they have retained and how much they understand about our field now. And so the outcomes, we hope that residents will have a better understanding of radiation oncology, that we will understand where the gaps are in medical school, and that we will increase the awareness of radiation oncology amongst primary care colleagues here in Oklahoma. Thank you.